So this is a brief video to discuss the maintenance and the sanitation of the filters that you've made for yourself, both when you get home as well as at work. The system that I've come up with has evolved over time, in large part due to trial and error and just kind of trying to think about the process of keeping the filters clean, keeping myself from getting contaminated, and those kind of things. Quite surprising, I came across this article yesterday that was published in the Journal of American Medical Association. It's an editorial which describes the things that I'm sharing with you as being very reasonable options to try to avoid the use of PPEs. So if you're in healthcare or you're just interested, I'm going to put a link to this article. It's an easy read, but it talks about what are the things that we should be doing to help ourselves. So that's that. So in terms of the filter, 3 weeks ago when I embarked in trying to make a reusable filter mask, I came across the use of an HVAC filter, which, if you think about it, generally does a very good job of filtering small particles. And the one that I chose was the one that I could get locally, the highest grade quality HVAC filter at my local hardware store. And based on that, I started working backwards about trying to preserve the lifespan of the filter, as well as trying to get some additional filtration in the process. And that's where I came across using a washable cloth mask. A washable cloth surgical mask in addition to the filter inside. So once I developed the way to make a custom filter, then I began thinking about, well, how am I gonna wash this? How am I gonna sanitize this? How am I gonna keep it clean so that I can use it again? And the very first thing that came to my mind is, well, let's just wash it and see what happens. And again, washing it, I thought, well, okay, the best thing that I can use to really sterilize it is to try to use some bleach-like products, and that's what I did with my first filter. I initially wore it. I was able to wear it pretty comfortably for 3 to 4 hours, and then I washed the filter in bleach. And this is an example of what happened with just the very first wash of bleach. And this also happened with OxyClean, or a peroxide-based cleaner, but you can see there's oxidation of the metal already. So that already makes the aluminum much more friable. But if it's doing that to the aluminum, you can pretty much guess what it's doing to the fibers that really you need to filter. So I knew that wasn't the answer. And as I did more and more research, I realized that normal just detergent actually does a really good job of killing the bacteria, but also removing the bacteria. The detergent essentially works at the wall of the virus. It penetrates the wall, it exposes it, and water enters the cell of the virus and basically kills it. So as long as you're able to wash it in detergent, it actually is quite effective. So the next logical step was that I started washing it. The first 2 times that I washed it, it seemed like it was holding up pretty well. I got up to 5 days and it looked okay, and then I got up to a week, and you can kind of start now seeing that the fibers of the mask were starting to separate. So it does look like over time it was affecting the filtration of the filter. That long-term does not seem to be a good answer. Now, I will tell you that if I'm in a pinch and one of my masks is soiled and it otherwise looks pretty good, I probably would wash it, but I'm not going to use that as my primary source for sanitizing the filter. So as I started looking at what products are known and have a track record of being able to actually kill virus and bacteria, the obvious choice that I thought of was isopropyl alcohol. why this over other things? Well, mainly because it's readily available. And when you spray it, it actually dries fairly quickly, and it doesn't leave any odor, unlike other agents that can also do the same thing, but it's not any chemicals that I want to inhale. So isopropyl alcohol makes an ideal choice. Now, I will tell you that it is not recommended, and I would agree with this, that you don't soak your mask in isopropyl alcohol for the same reasons that I talked about the bleach. I do think that if you soak them in it, that it's likely to damage the filter and the aluminum frame. But I do feel that it does do a very good job of killing the virus on the surface of the mask. So that's what I've been doing, is I carry around this bottle, this spray bottle, both for work and when I arrive home, and that's how I'm sanitizing it immediately. Now, the next part that I'm going to show you is what I do when I arrive home. And then after that, we'll talk about my suggestions to you about how to handle the filter when you're at work and you have to remove the mask temporarily. All right, here you go. Okay, so this is the system that I set up for myself when I get home. I've labeled these Ziploc bags for the individual filters. You can see I have 7 filters set out. I'm not going to be using them all, but I have them labeled out for each day. So my routine is when I get home, I've obviously taken this off at work. I put it in a washable bag and I put it in the trunk of my car. And so when I get home, the first thing I'm going to do is I'm going to remove it from the mask very carefully. And then what I'm going to do is I have isopropyl alcohol. And what you want to do is just spray the mask. Okay, and then you'll drop it in the day that you used it. And the goal is to not use it for at least 72 hours. And that's why you want to cycle your filters so that you're not using them. And with having this system, then I'll be able to go through the entire week before I go back. And so that's plenty of time. That'll be essentially 5 days before I get back to that filter. So that really reduces your risk, since as far as we know, the virus does not live beyond 72 hours. Okay, so this next part is what I would do at work. So obviously there's going to be times you're going to need to take a break, you're going to need to go to lunch, and you're going to need to remove the mask. How do you deal with that? So this is my suggestion to you is you're going to be taking your mask to work every day. I use a reusable washable bag. So, when I get in the car, I'm putting my mask with the filter already in this bag. So this needs to be available to you at work. So you're going to go and take a break. The very first thing you're going to do is you're going to go and wash your hands thoroughly. And what I would suggest to you is, in order to make sure that you do a thorough job of washing your hands, is to wash your hands from the tips of the fingers to the elbows, and that you really take your time doing that. That does 2 things. They talk about needing to wash your hands for about 20 seconds. It's going to force you to take more time to wash your hands, and that's really important. So when you finish washing your hands, you should rinse like surgeons and people in the OR do, which is that you put your hand under the sink and let the water drip from the tips of your fingers down towards your elbows, and then kind of hold your hands up a little bit, and the water will drip down the elbows. And so once you're done washing, then obviously dry them really well. Once you've done your hand washing, go and get your bag. The next thing you're going to do is, now that you have your bag ready, is you want to make sure that you also have your isopropyl alcohol bottle readily available. And what you need to do here is very carefully remove your mask. And so the way you want to do that is you want to avoid contact as much as possible, any part of the mask to your face, as you're removing it. You don't want any contamination to your eyes or your mouth. So you want to do that by removing the straps forward. So now I've got the first strap loose. I want to open it up and then forward until it kind of comes off of your face. And the lower one's going to be a little bit harder, but you can still do it. Take your time, get around, open it up, and now you've removed it. Hold on to it, and this is where I would get my isopropyl alcohol, and just spray the whole thing. You know, you don't have to saturate it, but make sure that you've sprayed all the layers. Now that you've sprayed it, you need to put it in your bag. So put it in your bag and let it sit there. So once you've deposited your filter in the bag, then you need to go and wash your hands again. And ideally, you should wash your face, because you have to assume that there potentially could be some virus particles around your face. And so you've exposed that, especially if you're sweating. If you're sweating, remember that is just going down your face. So I would suggest to you that if you're going to do it right, is to wash your hands and wash your face. Go and enjoy your meal, go enjoy your break, and then when you come back, if you've really have touched any surfaces, ideally you should be washing your hands again. I mean, this is a routine that we need to get into, and this is really in your benefit, to your family's benefit, but also to the people that you work with. And I think if you do it that way, it's less likely that you're going to get it, and also less likely that you're able to transmit it to someone else. So that's my suggestion. An alternative would be, instead of using hand soap and washing your hands, is to use hand sanitizer. And obviously that's a lot quicker and would work well for your hands. It's not going to be something you want to apply on your face, but an alternative for your face would be to use baby wipes, or those kind of cloth wipes, and just kind of clean yourself well. So anyways, that's kind of my approach to this. If you have any suggestions, obviously I'd love to see your comments. Hopefully this was helpful.